energetic and Secretary of Gwalior Academy of Pediatrics. And Dr. Praveen Garg is energetic, hardworking and very humble.
I am dealing with the last session of this conference, so I am thankful to the organizing committee that they have given me a chance to come and to speak with you and to interact with you with the trust of this whole 2 days conference. I may not be very much prepared for it because I was not aware that there is a talk, scientific session. When I saw there is a talk with me on tomorrow, so I just prepared a little bit on this topic. So please, मेरे साथ झेलने तो ज़्यादा अच्छा रहेगा. The topic healing professional, restoring trust in medicine. This is the final word that shows that whole the medical profession is at the trust nowadays. Initially, when about 10, 12 or 20 years back, we had a good friend of our family doctor who knows all the insights of our families. He knows what our family wants, how we living, and he knows our elders, our youngsters and our elders, all the ancestors also. So whenever we had some problem, we usually goes to them. They deal in a very friendly manner and they guide us what to do and what not to do. And we had a good trust into them. We usually follow whatever they say to us. We don't have any hanky-panky that this would be wrong, this would be, we had to go to some specialist. We would ask with them. Nowadays, with increasing the corporate culture, that whole the corporate and much more fancy corporate culture hidden with this friendly doctor's name. And this whole changeover from a family doctor to a fancy corporate hospital, the whole burden or whole the things is going only on to the doctors, that they had lost their credibility, they had lost their trust into the public. And we are now here again to see the pitfalls where we are lacking, which are leading to these public trust in the medical profession and how we should restore it. The meaning of this professional healing is, it depends on the critical role of the healthcare provider in rebuilding the public diminished confidence in the medical system. We had to restore the things by which we can restore our trust with the public. That does not involve only a shift from a purely disease-focused scenario that we have to treat only a single disease, but our approach should be a central transactional approach that contains an empathic hearing from to the patient. The main or whatsoever the literature I had gone through, that every trust lands onto the doctors only, that we or our colleagues are not hearing to the public, hearing to the patient empathically. They are very much rushed onto it. So we have to improve our working, that we should be empathetic to the patient. And we should have a very transparent thing in our mind, that whatsoever we are saying, that should be very much transparent. There should not be any hanky-panky to it. Addressing the physical, social, psychological and spiritual dimensions of the patient suffering. We don't have to restrain only onto the clinical aspect, that we have to treat the disease, that we have to leave up to the God. We have to, in toto, we have to treat the patient, we have to treat the family, we have to see what the social responsibilities, psychological aspects and the spiritual dimensions of the patient by which we can correct the patient. For this, we had different things. Only with the curing the disease, that curing purely the physical disease by technical and scientific methods, that does not gain the trust with the patient. That contains a healing the whole person by addressing their sense of wholeness, by narrative nature, by spirituality. We can let them aware that only with the healing only or with the instruments or with a more scientific method, we must be dealing with their own family matters and we should have a good faith into it. The importance of trust, that fundamental to effective healthcare. If we lose the trust, the whole the healthcare would vanish down. That more likely to communicate when we had a good trust with the patient. Patient is more likely to communicate openly with us. He adhere to our treatment plans and they experience better health outcomes. If we don't have a trust in the healthcare with our patient, all the things will vanish off. So we have to improve the trust with the patient. And the erosion of this trust is just because of too high cost of the medicines, systemic inequalities, that when two persons are sitting together, one is a very rich person and one is a very poor person, the person who is sitting with a very poor socio-economic group, he sees the difference in the health system. So we have to take care of it so that there should not be any inequality in it. Simultaneously, we have to focus on the profits over patient. We look after the more the profits on irrespective of our care to the patient. So we should have a policy, we should have our own fundamental plan so that there should not be any condition which face the patient due to high cost. He is not able to take the different therapies, and systemic inequalities that burden or that lose the heart of the poor person. And we should focus not only onto the profit but our patient. The profit will definitely generate if we will give our proper care to the patient. Restoring the patient-provider relationship, maintaining the doctor-patient relationship, sometimes become personal because sometimes the doctor gets rushed or that we become impersonal, then we should lose our relationship or trust with the patient. This requires empathy and a compensation, genuine care, listen actively to the patient concerned, involve them in decision making. Whatever the decision we are making, that this therapy would be comfortable to you, we should explain it to the patient so that his own decision should also come into it. And there should be a transparency and open communication. Should be honest about diagnosis. We should be clear about the treatment options. We should tell the risk of our therapy and the limitations of the medicines up to which we would be able to reach up to the mark, avoiding confusion or basic messaging. The integrity and accountability act ethically and consistently. In patient best interest and paramount. We should not think of moving out to the profit part of the hospital, profit part of our own pocket, but we should have a proper interest that what would be the best for the paramount of the patient and how can we would be able to take out the patient from this condition. Addressing system should be advocating to the affordable care. We should let know the patient about the affordable care, then how much invest we have to do in that care. Addressing the health disparities, that where he would be getting a cheaper health care and where he would be getting a higher health care. The patient voices are heard in the organization planning. When we are making a planning in an organization, we should take and commands, we should take the decisions or the requirement of the patient, then only we can plan our organizational therapies or the process so that we can have a full part of the patient also. The personal and professional growth, it is not just a job. Ongoing self-cultivation wisdom, navigate the challenges of working in a complex environment and maintaining a compassionate intention to give a trust and to have a trust onto the patient. Keys to restoring trust in healthcare, that our job is to restore trust, but our job is to make ourselves trustworthy. If we just want to have the trust onto the patient, we should have to behave like that we are so much trustworthy to the patient, to the family and to the atmosphere who is coming to the healthcare person, that he should be always, he should be very much dealing with the patient only, not with the professionalism or not with the hospital part. Our trust should be an equation of predictability, reliability, intimacy, and these three things depend on our self-orientation. If we are oriented how to be and how to maintain our reliability, how to maintain, show our intimacy and our credibility, then only we can be able to make a trust equation affordable, or we can have and generate a trust into the public. Make care more affordable for the patients and ensure they have access to need therapies. We should not increase the cost of the therapies so that they are not, the patients are not able to take the therapies. We should fix a price that should be affordable to each and every person. The value-based healthcare, not only they are medical needs, but also they are health-related social needs. Just a minute. Nurses need to have a prominent role in the clinician strategy and discussion, and clinician is the key person to implement the strategy by making a trust. Make prices and other key information more transparent and digestible. Billing prices should be very transparent, very open and very correct. Underlying inequity assessed in health outcome must be addressed as a precondition of building trust. Further diversify the clinical workforce and other patients facing staff. This is just because of inequity. If two blacks are getting a healthcare, if one black person comes and another black person is taking care of it, so that shows an inequality. So better we should have the multiple persons in the healthcare system. They can be directed to take the good health of the person. Take home message: train young doctors and aspiring medical professionals to meet patient expectations. Listen them with empathy. Embrace a more human approach. And the only cure to the current healthcare malaise is rebuilding lost trust. Our whole healthcare providers should be committed to holistic, humanistic and transparent approach to care that prioritize patient well-being and re-establish a strong foundation of confidence with the public. Thank you.
Okay. You are truly our star showstopper. I think it was the last session. And thanks to the organizers, thanks to the doctor, dear Dr. Sathwik, and thanks to the all audience being with us till the last breath. Thank you so much.
Thank you so much, sir. Truly, you